Namaskar, myself Dr. Garg. One question is, can female get hair transplant or only male? This is the privilege for the male only. No. Female can also go for hair transplant if needed, and that transplant is also very successful, that too without head shaving, because it is commonly taken that whenever you go for the hair transplant procedure, there will be complete head shaving, and for a female, complete head shaving is just not possible. So we'll talk on the female hair transplant and what are the procedures, when it is done and how it is done, and few cases of female hair transplant I am going to show you. Let's start now. So the question is, when to do hair transplant for a female? Means what are the conditions in which the female needs hair transplant? The most common is, many times by birth one female has got a broader forehead, means the hairline is little on back side, her forehead is broad. Sometimes because of the broad forehead and this also receded temple area, his face looks masculine. A female face is egg-shaped or slimmer. So hair plays a very important role in making the female face like a female or like a male. So hair has got a great role in the aesthetics of the face. So one condition is by birth, if patient's hairline is receded or hairline receded because of the hair loss, or some patient wants to lower his hairline because of various other reasons like modeling, or sometimes some go for doing the serials or pictures and all that, in that they will be making some lowering of the hairline. So in that condition the female might need. Then a condition in which a postmenopausal woman or a young girl has lost hair, the density has decreased, even in spite of medical treatment, her scalp shows prominent. In that case also the female needs the hair transplant. Now what is the method in which the hair transplant is done for the female? Is the most commonly method is the FUT. FUT means a strip of skin is taken from the back side of the head, and then after the gap which has been created is sutured. The advantage of this, the donor area need not to be shaved. Only a very small strip area is shaved, which we are going to take it out, and after taking out, that is closed. So back side of the head is not shaved, and the top of the head is also not shaved. Top of the head is otherwise also not shaved, whatever the procedure we are doing it. Only it is the question of shaving the donor area. So in FUT, donor area is not shaved. So there is virtually no shaving for a female for the hair transplant. Okay. The next procedure is the FUE, in which individual follicles are being extracted and then they are implanted. So in that there are few machines or the punches, specialized punches, in which non-shaven hairs are harvested, means without doing the shaving the follicles are being harvested and they are being implanted. So that is one method. Then again, the females who keeps their hair short, in that condition they may allow some shaving, limited shaving of the backside area, or postage step shaving, or some shaving in a small zone. These are the many other methods in which if hair follicle in the female can be harvested by using the FUE technique. Now female hair transplant is little more complicated, require more expertise than a male, because the hairline has got many different peculiarities as compared to the male. Like, let us, what are those? She has got a central mounts or widow's peak we call it. Then there is no frontotemporal recession, and there are the lateral mounts are there, and there is a temporal peak, and the hairline is little lower than the male. So male hairline is little higher up, female hairline is lower. So few important aesthetic points just for your knowledge I am giving you, although they are not important for you. There are 5 areas. These are the 5 important areas: sideburn area, temporal area, frontotemporal area, and the central area, which are aesthetically to design the hairline. This is again the 5 P's are there, 5 points we call it A, B, C, D, and T. These, when you join them, after putting and then you join them, that's how you make a very aesthetic design as per the face of the patient. That's how we created. We had the 5 areas, 5 P points, and then we joined them one up. And the location of these points depends upon what problem she had and what female wants. So these were the points we created, then we join it, and that's how it looks. Then sometimes it can be reverse, it can be concave to decrease the width of the forehead. Reverse shape is if you want to decrease the horizontal width of the forehead, then we make it convex forward. If you want to increase the length, then we make it concave. So these are the very, very important and technical points which should be taken care by the surgeon and depend on the patient desire and the shape of the head. Like this female, you can see the density was low here, and then the hair transplant was done, and you can see how beautiful it looks. This is again important. As I said here, it can be straight line, it can be concave forward, it can be concave forward, or concave forward and convex forward. Again, what you want to do with, in what way you want to convert the face, means width and height. If you want to increase the height, when you will increase the height, face will become more slimmer, become more feminine. If you decrease it, then the forehead width is decreased. So you have to consider all these points to make a very aesthetic, good looking hairline for a female. That's how we created here. Now you see how beautiful it looks now. This condition was like this. We created a concave, and how beautiful it looks. So this is again important point. Now again you see this, what we did, we designed it in toto. Then we did it, and now see the final result. Now this female has the low density in entry area. This forehead looks very broad and masculine, and just after building up of this area, her face looks slimmer. This has become egg-shaped, long, so it is looking beautiful. Again, here that low density is there. Hair transplant was done. This is the basically the whirl is widow's peak is there. The direction of hairs are very complicated in this area. Here is this direction and this is this direction. So you need to take care of this deviation point. We call it as a deviation point. This has been created like this. This is a pre-op. This is pre and post-op. This figure has got reversed. This is before surgery and this is after surgery. Okay. This is called as the part line. DP means deviation point, that was the deviation point. This was the deviation point. Many times the surgeon thinks deviation point and part line are same, but no, they are not same, they are different. So this is the part line. There was a low density in the part line which was increased. Okay. Now there is another case in which there was central thinning here, hairline. The transplant was done, and how now nice it looks now. Another case, broad forehead was there, thinning in the temple region, which was built, and then you can see the result. This was a very broad forehead. Hairline, this was right from birth, and there was a thinning also because of the endogenetic alopecia. We did the transplant in this broad hairline down, and you see the forehead now. This is so much of the thinning here. After doing the hair transplant, how beautiful it looks. This is another same face, another side. How much density we have put in inside. So now after getting hair transplant, you would like to know when my hair will grow, because many times your daughter or your son is getting married, or you need to attend some marriage or some other function, and you want to look good, so you will plan when my hair will grow when I go for hair transplant. So the answer is, when hair transplanted hair will grow 4 months after the hair transplant procedure. At actual length or real result comes after 6 to 12 months of the hair transplant. So at least I'll say 6 months should be given to see the effect of the hair transplant. And they grow, they naturally grow. You can cut them, you can dye them, and they do not need any maintenance. And the complication or side effect of hair transplant are very, very, very rare. Then the question is the maintenance. What you will need to do that after hair transplant? Maintenance is nothing much. Just maintain your happy, healthy life. Take good diet, multivitamins and all that. Good nutrition. Do some exercise. No smoking, no tobacco. So that's how the hair transplant can be done in the female. It's a safe procedure. If you are low density, if you are receded hairline and you want, then you must consult a doctor, discuss with him all the points, and then you can safely go for the hair transplant. Thank you very much.